My primary ENT focus is oncology, both in research and in surgical practice. We treat patients with a range of diseases of the ears, sinuses, or skull base. Many of our oncology patients suffer from tumors located all over the head, of the larynx or throat, the tongue and tonsils, or of the sinuses. We treat all patients with an interdisciplinary team, working hand in hand with oral and maxillofacial surgery, neurosurgery, and ophthalmology. What makes surgery so challenging is en-bloc resection, taking out the tumour as a whole whilst maintaining the anatomy and function of the head and neck area. We rely on a wide variety of tools to identify target areas and get clear margins during surgery. We also use intraoperative navigation to visualize the nerve system in order to best protect it. During surgery, we can use intraoperative MRIs or CTs to get a clear view of the surgical field. If we find remnants of cancer in the margins, we can excise those right away. Let's take the skull base as an example. It is located between the brain, eyes, and sinuses. Oftentimes, we can approach it bilaterally. The neurosurgeons access the site via the skull, while the ENT specialists use a transnasal approach. For every cancer patient, we first do pathological testing and then discuss all results at an interdisciplinary tumour board. We consider which treatment options may be best for our patients and what we can offer them here. This includes surgery, radiotherapy, chemotherapy, and more recently, immunotherapy. Immunotherapy prior to surgery can be very advantageous for patients. Heidelberg was one of the pioneering hospitals for treating cancer patients with immunotherapy, and we are proud to offer this kind of treatment for our patients. Here in Heidelberg, it is all about research, and oncological research in particular. The German Cancer Research Centre and the National Centre for Tumor Diseases are located on our campus, and we work closely with them on a daily basis. Our objective is clear: finding the best treatment combination by harnessing the power of translational research. How about immunotherapy first, and then surgery afterwards? How can we combine that with radiotherapy and chemotherapy? To this day, I vividly remember treating a patient who had suffered from mouth tumours. He had already undergone surgery, radiotherapy, and also tried immunotherapy. When he came to Heidelberg, we included him in a clinical trial for a new kind of immunotherapy. For this approach, we inject the medication directly into the tumour. The treatment worked. The patient's immune system was activated and eliminated the tumour completely. At the ENT department, we can rely on an excellent care team that guides patients through their treatment, start to finish. We offer specialised treatment plans for every international patient that take into account the long travels necessary to get to Heidelberg. We make sure that we chose treatments and follow-ups that work for the patients, regardless of the distance where they come from.